Well, let's continue our coverage tonight looking at the situation where the COVID-19 numbers are concerned, in particular in India. We'll take you live to New Delhi. According to a mathematical model of a team of scientists advising the government, India's COVID-19 cases may peak between the 3rd and 5th of May. It comes as coronavirus spreads faster than expected. India's second wave has been fueled by lax safety protocols and massive public festivals and election rallies, which has overwhelmed hospitals. Joining us now from New Delhi is the Tribune's former senior editor, Prasad Kunduri. Prasad, good evening, and thank you so much for your time and for really being willing to give us a sense of what's happening on the ground in India. What are some of the things that you've been seeing over the last couple of weeks as the rest of the world has really been watching the numbers of COVID-19 escalate there?
Well, of course, good evening, Katie, and to the viewers of Newsroom Africa. Well, yes, the numbers are worrying. The numbers are climbing. For the last 3-4 days, it has been hovering around between 350,000 to 400,000 people. The government is, both at the center and the states, are doing the best to try and see how to contain and control the spread of epidemic and the pandemic. A number of steps have been taken, number of measures have been taken. Which includes localized or state-wise or district-wise lockdowns, restricting movements of people. So there are steps, and also ramping up the vaccination, which has already entered more than 100 days. We started on January 16th for the frontline workers. As we speak, I think the numbers of people who got vaccinated stand something around 150 plus million or 160 million people have been vaccinated. Katie?
What have been some of the challenges? Because when we look at the global reporting, there's been a lot of talk about the shortage of oxygen. This is at various hospitals in India. But from your account, in terms of what's happening in your country right now, what would you say are some of the biggest challenges right now?
Well, as you pointed out, the oxygen shortage has been reported widely, and a large number of beds, because of the sheer numbers and the exponential growth and spread, the hospital system has come under severe stress. So in order to, the beds, the government has, both with the states and center, is trying to augment hospital beds, many with oxygen supporters and some with ventilators. These are being makeshift hospital beds are being created. For instance, the Indian Railways is having dedicated coaches stationed near, kept near railway stations where COVID isolations are working as COVID isolation centers in many big sports arenas, or have been converted into temporary hospital areas. Members of the armed forces, the police and others are pulling in their might, pulling in the resources to try and augment the hospital supply, both in terms of the reach of medical personnel and also critical medical supplies, including medicines and whatnot.
When we look at the official COVID-19 numbers in terms of the tests that have come back positive, that currently sits at over 20 million. But there have been concerns about a slowing down in the rate of testing that is taking place. Speak to me about that.
Well, there are two aspects to it. One, because the sudden rush of numbers, people landing up at testing centers, the results got delayed. There was a huge backlog because the test capacity was so much and the numbers were turning up at high clip. Of course, the testing guidelines have been revised to keep up with the pressure, and also augmentation in terms of region kits and others that are being made available. The Indian Council for Medical Research, the premier national body, today came up with a revised set of guidelines as to who needs to be tested at what time and what exactly is the sequence, other things, including trying to avoid interstate travels, because since the COVID protocols began last year and government began the unlock process, what happened was if an individual was to travel from one state to another, he or she would have been required to undergo with a RT-PCR test, which is also the norm in many international travels. I think that is being increasingly discouraged. One, to prevent people from moving from one city to another. And as it is, because of the series of lockdowns in separate places, people are not moving as much as they would have in normal terms. Katie?
There also seems to be some disputes when it comes to the numbers that are being recorded in terms of the fatalities and who exactly has died from COVID-19. And we've had a similar problem in South Africa, where the mortality rate under the past year is so vastly different to what it has been in previous years. And, you know, many scientists saying that that gap could well account for people who died from COVID-19 or associated symptoms, but it wasn't officially recorded. We're seeing images coming out of India of crematoriums that have been packed to capacity, and, you know, officials there talking about their own trauma of what they've been seeing. When you look at those numbers, and in terms of the officials in the country, do they feel it's a fair reflection of what's happening right now?
There are two ways to look at it. One, because of the COVID test results, as I mentioned during this earlier phase, is the test results getting delayed. As a result of it, people being declared COVID positive, and then the protocols kicking in. Those who have been admitted into medical facilities or are under isolation, and if they are post-COVID testing, so obviously he or she, the person, would be declared as a COVID mortality. But there have been instances, many newspapers and news organizations have reported it, that there's been a mismatch between those being officially recorded as COVID-related mortality to those who are actually landing up at the crematorium and the burial grounds. So there is this reportage issue that is coming up, and many news organizations have failed, but there is no codified data as of now for me to give you. But yes, people are flagged concern to the authorities. The numbers are being reported. There is a difference. Katie?
Prasad, as a journalist, what has this period been like for you? Perhaps even in your ability to be able to do your job, to get out there and to really see what's happening?
Well, to be very fair, right from the strictest lockdown we had in 2020, the journalists were exempted from the curbs, largely because we had a job to do. So many of my colleagues had to travel out and find out for themselves so that they could report the true reflections from the ground. Over the years, of course, people had to keep the safety protocols in mind and also ensure. There have been a number of fatalities in our fraternity in the last few weeks. In particular, we have lost a lot of colleagues, mostly to this dreaded disease. And now, increasingly, governments are being told, whether it be the states, that please declare journalists as frontline workers and get them to inoculation centers and give them inoculation priority. And why that is being said is because as of only on May 1 did the government open up the vaccination for people over the age of 18. Earlier, there were, even though we started our inoculation in January 16th for frontline workers, there were restrictions of who could actually be eligible for jabs. People like me over 60 were eligible, but many between 45 and 60 had restrictions. Now those have been phased out. So this is an issue journalists are facing. Many of them, we have lost a lot of young colleagues, and many are still down with this dreaded pandemic.
It's an absolutely devastating state of affairs. And thank you so much for coming onto the show tonight and sharing your experience and sharing the story of what is unfolding in India right now. That was former senior editor with the Tribune, Prasad Kunduri.